Hello viewers, after marriage when you are trying for pregnancy, most of the gynecologists will ask you to do a semen analysis test to rule out male side problems. For female side problems they will be doing hormone tests and a scan and AMH test, but for male side generally they ask for a semen analysis test. So now semen analysis test, why it is important and where this has to be done? This is an important question. See, what happens is, now most of the people they go to a diagnostic center and they do semen analysis, and most of the reports from diagnostic centers they look normal, and particularly if you look for morphology, they give morphology as 80% normal, 90% normal, and some semen analysis reports they don't even give a figure. They just say morphology is normal. So now a doctor who is treating your wife will think that everything is normal based on the semen analysis reports, and they will start concentrating on your wife's treatment. But what happens is, what if this report is abnormal? So the entire treatment plan changes. So now why semen analysis is important, and the place where semen analysis is done, that is also very important. See, what happens is, WHO, World Health Organization, it releases guidelines once in every 4-5 years regarding semen analysis. That means any fertility center in the world, they have to follow this guideline. Now we have 6th guideline which was released last year. So now what is importance of these guidelines, and do most of the diagnostic centers follow this guideline? According to me, it's no, absolutely no. 99% of diagnostic centers they don't follow WHO guidelines. Why? Means it's a difficult task. See, now fertility centers, see, when you say about semen analysis, most of the diagnostic centers it is done by regular lab technicians, but in andrology centers or fertility centers this is done by andrology technicians. That means these people are basically trained in andrology lab tests, semen analysis, semen ROAs, semen DNA fragmentation index, and semen cultures, and IUI preparation, sperm suppression. All these are the tasks which these people do regularly. So now their duty is to, they are like specialists in that particular field. So now what happens when WHO releases guidelines is, most of the centers they train their technicians according to new guidelines. Even our center, we have a training program. We train at least 4-5 lab technicians every month, because most of the fertility centers they send their technicians to us for training program. So now what happens, why it is different is regular lab technicians they can't upgrade, and their centers or their management can't send them for upgraded training program every time, and because most of the chains of laboratories they have hundreds of technicians, sending all these people for training is difficult task. So generally they don't concentrate on semen analysis, they concentrate on regular blood tests. So regular blood tests, what are the new machines available, how to upgrade, that part will be taken care of by the companies which are producing or supplying those machines which help in regular blood tests like hormones and regular all other blood tests. So but hiring an andrology technician, there is scarcity in India, all over the world there is scarcity. So these diagnostic centers initially they can't afford to hire a andrology technician. So they continue to do semen analysis with the help of regular lab technicians, that is where the problem is. So that is where when you compare a semen analysis report from diagnostic center and semen analysis from an IVF center or fertility center, both are totally different. The pattern, the depth inside the semen analysis report and parameters what they report, they are totally different. And most of the diagnostic centers, they don't have a proper semen analysis collection room. They will ask you to collect semen analysis in a toilet, which is uncomfortable. But whereas most of the fertility centers and andrology centers like us, we have a decent sample collection rooms with a decent room with a connected toilet, and sometimes we provide material, and there are some videos or TVs continuously playing in the background to help in semen collection. So that is why we recommend doing semen analysis in fertility centers. Sometimes people coming from villages or small towns, we ask them to, instead of doing a semen analysis in that small place, it's better for them to come to our center or any fertility center in the morning with 3 days abstinence and then do a semen analysis, so that they will get the report by evening. So that is the reason why we say the place where you do semen analysis is also important. Thank you.